Good morning. My name is XhosaCancer. I'm the clerk at Tygerberg Hospital at Cancer Unit. I have spent much time with patients just like you, and I would like to take you on a journey through the Cancer Unit to teach you more about the treatment you are going to have.
This video is an information video on chemotherapy and is shown to you in your own language to make sure that you understand your treatment really well. This treatment is offered at many other hospitals in the country and the world, and some patients from different hospitals might be watching this video. Everyone is welcome on this journey, and we hope that many of your friends and loved ones may also see this video, because it is good when you don't have to go on this journey on your own. We treat many people with many different types of cancers at this hospital. Some people may have cancer in their breast, others may have cancer in their lungs, or another part of the body, or more than one part. It is important to understand that every type of cancer is different, and every type of cancer needs its own treatment with its own side effects. Many people will tell you about experiences they have had in their own lives or with people they were close to. Sometimes these stories are good and make you feel strong, but sometimes these stories are not nice to hear and they may scare you. It is important to remember that everyone's cancer is different, and the only person who can tell you the facts about your disease is your doctor. Your doctor will tell you about your own type of cancer and what the treatment involves, and can answer whatever questions you have. If you do not understand English or Afrikaans, it can help to bring a family member or friend who can speak English or Afrikaans when you visit the doctor. If you cannot find anyone to come with you, please tell the doctor so that a translator may be called to help you during your doctor's visit. Today you will receive a letter from your doctor that says what type of cancer you have and how serious the cancer is. This letter is very important. Please show it to your day hospital or local clinic so that the workers at the clinic will know what is wrong with you and whom to call if you need help. Cancer is not a new disease. It has been around for thousands of years. Not only people, but also animals and even plants can get cancer. Cancer is not a disease of poor or dirty people. It affects all people regardless of their race or financial status or beliefs. We know that cancer tends to affect older people, but younger people and even children can develop cancer. We develop cancer when a certain part of the body develops a lump that grows like a weed. It starts small, but if it is not pulled out by the roots, it can grow strong and big like a tree and even spread to different parts of the body. It is much easier to cure a small cancer than it is to cure a cancer that has spread to other parts of the body. This is why it is important to start treatment as soon as possible. Cancer can return to the body years after the treatment is over. And that is why it is important to come back for your checkups, as is written on your appointment card. It is always easier to cure a cancer that has come back when it is small, before the roots are deep and it spreads around the body. Some people may say that cancer can be caused when an enemy curses you, or that cancer is a punishment for sins.
We are working hard to know what is the causes of the cancer, but we don't believe that is the punishment for your sins.
The treatment you will receive here is very powerful, and if you receive all of it, especially if you get it before the cancer has spread too far, it will help you, regardless of what caused the cancer.
We use several methods to treat cancer.
Many patients have surgery to cut out as much of the cancer as possible. If that is not enough, other methods are used. The two most common ones are chemotherapy and radiotherapy. Cancer is a disease that may come back after an operation was done to remove the cancer. This happens because tiny cancer cells that cannot be seen with the naked eye may remain behind and start growing again. The best way to avoid this from happening is the use of X-rays to kill these tiny cells. Radiotherapy is therefore used to decrease the risk of the cancer coming back after the operation was done. It is sometimes very difficult for the surgeon to perform an operation because the cancer may be very large or may be growing in a place where it is too dangerous to cut the cancer out. Radiotherapy is good in this case because it will still kill the cancer cells in the area where the operation was too difficult or too risky. And sometimes the surgeon will do an operation after the radiotherapy was done to make the cancer smaller. It is important to remember that every patient is treated differently because every patient's disease is unique. Regardless of what type of cancer you have, radiotherapy is really, really important in the fight against cancer and will benefit you if your doctor has offered you radiotherapy for your type of cancer. Radiotherapy is a type of treatment where X-rays are shone on a body area, much like a flashlight. Big machines are used to shine this light because the X-rays are given lots of energy to kill the cancer cells. Even though these machines are big, they cannot hurt you. I will now explain a typical day of radiotherapy to you. Some patients will start treatment the same day that they come to the hospital, and other patients will only start treatment about 2 to 3 weeks later. This might seem very confusing to you at this point, but your doctor has a reason to do it this way. The first step is to take images of the area that we need to treat. Your doctor will tell you which way is the best way for you. In both ways, you will be placed on a special type of bed with both your arms above your head. This position might feel a little uncomfortable to you because of the operation you have had. It is normal to feel a stiffness in your arm, and therefore it is important to do the exercises that were shown to you in the hospital. If you have not been shown these exercises, please ask your doctor to show you a few exercises. Don't be afraid if marks are being made on your skin. This is done because we need to shine the treatment beam in the same place every day. Sometimes we use little tattoo marks, as these last a lot longer than pen marks. Radiotherapy treatment is given every day on a Monday to Friday, but not over weekends. You can expect to be on the treatment bed for about 15 minutes every day. You will be told how many weeks of treatment is needed for your type of cancer, but it is normally between 3 and 5 weeks. That it is really bad to start the treatment and then to miss some of the treatment days. We only have one chance to kill the cancer, and therefore we need to give it in the strongest possible way. If you experience side effects or have transportation problems, please tell your doctor as soon as possible.
Do not just stay away from the treatment. We always try to help every patient so that we can beat this cancer together.
If you live far away, we will attempt to make accommodation arrangements for you. This may be either in the hospital or in a lodge that takes care of our cancer patients and is sponsored by cancer. As with all cancer treatments, radiotherapy also has side effects. We usually see that the skin in the area we treat may become a little darker and dry during treatment. Some people may not have any complaints during the treatment, but some people may develop a type of sunburn in the area they are treated. Sometimes this sunburn is treated with daily dressings, but it gets better after treatment and the skin returns back to normal. This is the side effect that most people talk about. But it is important to know that the skin reaction is different for every patient, and we are not able to predict how your skin will react to the radiotherapy. Your skin will probably remain a little darker in the treatment area for the rest of your life, but this is not painful or uncomfortable. Most patients are still able to continue with their jobs during the treatment, while other people complain of feeling a little too tired. Most people will say that they feel tired for about half an hour after the treatment, and some people take a rest. If radiotherapy is given after the operation to the lymph glands under your arms, we know that you might experience swelling of your arm in the months or years after the treatment is completed. This is a side effect of the treatment, and unfortunately, there isn't too much we can do to prevent this. Luckily, this happens to very few people and might not happen to you at all. It is normal to feel a dead area over your breast or under the arm in the area where the surgery was done. This is usually a permanent thing, but it becomes easier to live with because you get used to it. You are allowed to follow your normal diet during treatment, and we do not expect you to lose weight or to feel unwell. Your hair will not fall out from the treatment, and it will not cause nausea or vomiting. Please report any of the side effects you may experience to your doctor or nurse, because we will always try our best to help you with your experience. We have some good advice to you to keep your skin in the treated area healthy. The first thing is to keep the skin dry. This may be difficult in summer when it is normal to sweat. We ask that you buy a box of Mazina to use over the area and under your arms. This is much like baby powder, but better because it doesn't have any perfume in it that can irritate your skin.
We ask you that you don't use Mazina if your skin breaks open or it is wet.
We will give you a cream to use at this point. Be careful with the type of underwear you choose to wear. It is important that it doesn't scratch your delicate skin. Some patients choose not to wear any bra during the treatment, while other women wear loose-fitting cotton bras. There is no right or wrong way, as long as you don't irritate the skin in the treatment area. You are also asked not to wash this area during treatment. There are two reasons for this. Firstly, the very important pen marks can come off, and secondly, the soap and water may irritate the skin. You are allowed to take a dry piece of cloth to absorb the sweat in this area, pressing it lightly against the skin. Please don't even rub or scratch the skin. Please remember to tell your doctor if you think that you might be pregnant. Radiotherapy may be bad for the baby, and we need to be extra careful with the treatment if you are pregnant. Please tell your doctor if you have any chronic illnesses and which tablets you are taking every day. Please tell your doctor if you have pain, because pain is not necessary and can be treated with either a tablet or a syrup. You will be given a date for your next visit when you finish the radiotherapy.
It is important to come to the hospital on the day of your follow-up.
The clinic follow-up visits are usually for many years. Some patients are asked to drink a special type of tablet to keep the hormone levels in the body low. This is done so that the cancer does not have food to grow. Some women are not given this tablet because it would not be of benefit to them. If you are asked to take this tablet by your doctor, it is very important to drink this tablet every day. You can decide if it is easiest to drink it in the morning when you have your breakfast or at night when you go to sleep. The most important thing is that this tablet should be taken every day until your doctor tells you to stop, which is usually between 5 to 10 years after the treatment. If you have any problems with the tablets, please don't just stop taking the tablets.
There are other types of tablets that we can give it to you, and the treatment will still continue.
Radiotherapy is a special kind of X-ray treatment that is given to decrease the chances of the cancer coming back after the operation. It may also be given before an operation or instead of an operation when it is too difficult to do the operation. Radiotherapy has side effects like any other treatment, which go away after the treatment stops. The most common side effects are changes to the skin and feeling a little tired after radiotherapy. Some women may develop a swelling of their arms over the next few months to years, which is more frequent when an operation to the gland under the arm was also performed. Some patients will be asked to drink a special type of cancer tablet for between 5 and 10 years. If you are advised to drink this tablet, please don't stop taking it without telling your doctor. Alternative tablets are available. We are dedicated to your treatment and wish to reassure you that we will try to help you every step of the way. Please feel free to tell the nurse or doctor if anything is bothering you, and remember to attend every session from when your treatment starts.
May you have a safe journey and may you be blessed.